Hello everyone. We are students of Nursing Leadership and Management in Chaneka College, and today we are going to present group portfolio of Human Resources and Management. So let's start and welcome to this presentation on training new hire.
The topic of the presentation is training new hires. Training new nurses is a vital process that directly impacts patient care, safety, and staff retention in acute care settings like hospitals. Effective onboarding and mentorship ensure that new hires are not only proficient in clinical skills but also equipped to work within the organizational culture and follow safety protocols. We are going to explain some of the points in this presentation. The first one is quality is often effective mentor. Organizational responsibilities in training and orientation is the second one, in which we are going to discuss the organization's role in establishing structured training program for the new hires. Third one is criteria for performance assessment of new hires. We are going to define the metrics used to assess the competency of new nurses in critical areas. Importance. Proper training not only ensures that new nurses meet clinical and safety standards, but it also boosts their confidence and job satisfaction, which ultimately leads to the better patient care. Moving forward, I am going to explain why this is a human resource management issue. In this slide, I am going to highlight the connection between human resource practices and nursing training. HR plays a crucial role in development and retention of the skilled staff. Now, workforce competency, employee retention, regulatory compliance, and patient care quality. First one, workforce competency. HR is responsible for ensuring that new nurses have the necessary skills and knowledge to handle complex clinical situations. This competency is critical for ensuring patient safety and providing high quality care. Employee retention. HR's involvement in fostering a supportive, positive work environment through mentorship and training reduces turnover. Nurses who feel well prepared and supported are more likely to stay long term. Third one, regulatory compliance. HR is responsible for ensuring that training programs meet both legal and professional standards. This ensures that new nurses meet the regulatory requirements for patient care. Last but not the least is patient care quality. HR plays a role in supporting training programs that directly affect patient outcomes. Well-trained nurses provide safe and effective care, which reduces the risk of medical errors and improves the patient experience. Now I'm going to explain the key qualities of an effective mentor. Mentorship is essential in helping new nurses transition into a fast-paced and often stressful environment of acute care. The following qualities are critical to successful mentorship. It includes patience, communication, empathy, experience, leadership, and adaptability. First one is patience. New nurses often face a steep learning curve. An effective mentor allows them to take time to adjust to the pace and responsibilities of nursing without overwhelming them. Second one is communication. A mentor must be able to provide clear, actionable feedback. Open two-way communication helps build trust, where the new nurses feel comfortable asking questions and discussing challenges. Third one is empathy. New nurses are under significant stress as they adjust to the new role. A mentor who shows understanding and often supports help reduce anxiety and build resilience. Fourth one is experience. Experienced mentors possesses the clinical expertise to provide sound advice and guide decision making. They can also offer practical tips for managing patient care and navigating difficult situations. Leadership. A mentor who demonstrates confidence in their own abilities and decisions inspire confidence among new nurses. Even though effective leadership encourages new hires to stay calm and focused in high pressure situations. Last but not the least is adaptability. Different nurses have different learning styles. A good mentor tailors their approach to meet the individual needs of the new nurses, whether through hands-on demonstrations, shadowing, or verbal explanations. Thank you.
Organizational responsibilities for training and orientation. This slide covers the essential roles that the organization plays in supporting new nurse training. Structured onboarding. A thorough and organized onboarding process introduces new nurses to the hospital's policies, safety protocols, and the specifies of clinical tasks. A strong start helps new hires feel confident and prepared for their role. Mentorship and preceptorship. Mentors or preceptors are assigned to guide new nurses This pairing allows new hires to have personal point of contact for questions and hands-on learning, which increases the likelihood of success. Skill assessment during training. New nurses must demonstrate proficiency in core clinical skills such as patient assessment, medication administration, and emergency response procedures. Regular skills assessment helps identify areas where further training may be required. Ongoing education. Healthcare is an ever evolving field, and so continuous learning is key. Organizations should offer ongoing opportunities such as workshops, certifications, and seminars to ensure nurses are up to date with the clinical practices. Progress monitoring. Regular evaluations are essential to track a new nurse's development. This allows both mentors and managers to identify areas where the nurses excels and areas where additional support might be needed. It also helps ensure that the nurse is progressing towards full competency. Performance assessment and success criteria. This slide explains the criteria that HR and clinical managers use to assess the performance of new nurses, ensuring they meet the organization's expectations for high quality patient care. Clinical competency. New nurses must be demonstrate the ability to accurately perform essential nursing tasks, example patient assessment, medication administration, wound care. Proficiency is key to delivering safe, effective patient care. Time management. Effective time management is essential in a high pressure healthcare environment. Nurses must be able to prioritize patient care tasks such as assessing critical patients for responding to emergencies while also maintaining routine care. Critical thinking. Nurses must be able to quickly assess a patient's condition, recognize changes, and decide on appropriate intervention. The ability to think critically and make informed decisions is crucial for patient safety. Communication. Communication is a cornerstone for nursing practice. New nurses must be able to communicate clearly with patients, families, and healthcare team to ensure that care plans are understood and implemented effectively. Adaptability. Nurses often encounter unpredictable situations. The ability to adjust to changing conditions such as handling new patient needs or emergency scenarios is essential for providing the best care in dynamic environment. Why it matters. Assessing these criteria ensures that new hires are meeting the organization's high standards for patient care. It also provides insight into areas for improvement, which allows HR and management to offer additional support or training, thus contributing to the overall success of the new nurses and the quality of care of the hospital provides.
Now I will be discussing the organizational responsibilities for training and orientation of new nurses hired into acute care settings. This is a crucial aspect of human resource management that ensures not only success of new hires but also overall quality of patient care. First, let's explore the structured orientation program. Organization must establish a comprehensive orientation program that provides new nurses with the fundamental knowledge and skills for their roles. This program should include a mix of theoretical and practical training, ensuring that new hires are well prepared to meet the standards of an acute care environment. Next, we have mentorship programs. Pairing new nurses with experienced mentors can significantly enhance their onboarding experience. Mentors provide guidance, support, and a wealth of knowledge, helping new nurses to navigate their initial challenges and build confidence in their clinical skills. Ongoing professional development is another key responsibility. Organizations should encourage continuous learning through workshops, seminars, and certifications. This not only helps nurses stay current with best practice but also fosters a culture of lifelong learning. Assessing competencies is vital as well. Regular evaluation should be conducted to ensure that new hires are meeting the necessary standards and can perform their duties safely and effectively. Clinical skill training must be robust and tailored to specific needs of acute care settings. New nurses should receive hands-on training in critical areas such as patient assessment, medication administration, and emergency conditions handling. Additionally, introducing new hires to organizational culture is essential. Understanding the values, missions, and expectations of organization helps new nurses integrate more seamlessly into the team. Finally, it's crucial to introduce support systems. This includes access to resources such as counseling services, peer support groups, employee assistance programs to help new nurses cope with stressors of their roles. Now, let's delve deeper into structure orientation programs. A well designed orientation program should include various training methods. For instance, new nurses should engage in shadowing experiencing staff during their initial days. This hands on experience allows them to observe best practices in real time and gain insights into daily operations. As new nurses progress, they should gradually take on independent responsibilities. This approach helps build their confidence, competence as they transition from observation to active participation of patient care. Additionally, an effective way to facilitate this process is also done by mentorship programs. That is, the pairing new nurses with experienced mentors. Mentorship not only provides guidance but also fosters a supportive learning environment where new nurses feel comfortable asking questions and seeking advice. Moreover, it's important to provide training for mentors on teaching and communication strategies. This ensures that mentors are equipped with the skills needed to effectively guide new hires, making the mentorship experience beneficial for both the parties. So, organizations must have a significant responsibility to implement structure orientation programs that encompass comprehensive training, mentorship, and ongoing support. By doing so, they can enhance the onboarding experience for new hires and new nurses, ultimately leading to improved patient care and staff retention.
Ongoing professional development, it emphasizes the importance of continuing educational opportunities where nurses can enhance their knowledge through workshops, courses, and seminars. Second one is performance feedback is highlighted critical tools to help nurses identify strength and area for improvement for resting and professional growth. And second point is clinical skill training. What is clinical skill training? The clinical skill training stress the values of hands-on training for essential clinical skills and ensuring nurses are well prepared for patient care. And it mentions the use of simulations lab to create realistic practice scenarios, helping nurses refine their skills. Organizational culture focus on introducing the organizational missions and values to ensure staff alignment with its goal and purposes. Encourage activities that promote team integrations and relationships building, which are vital for collaborate and cohesive workplace. And second one is support system. Stress the importance of providing emotions health support resources such as counseling services to maintain staff well-beings, and mentions mental health support resources to help nurses cope with job related stress. Introduce easy access to training materials and ensuring staff can easily connect with sport professional for questions and queries, fostering a sportive environment.
Performance assessment of a newly hired employee. So first of all, let's have a look what is a performance assessment. Performance assessment is an employee appraisal where employee assesses the job performance and the productivity, often using the performance review software for accuracy and the consistency. This process considers key aspects from the review period, including the goal completion, project performance, culture fit, and peer feedbacks. Now let's have a look on employee assessment form. This form consists of various information such as of the names and address. Another one is the rating section. This use of the scale from poor to the excellent, that is 5. Another thing that involved in the rating section is the job knowledge. Assesses the employee's understanding of their role. The second one is the work quality. Look at the how well they execute their task. Third one is attendance or the punctuality. Evaluates the reliability and the timelines of the employee. Fourth one is initiative. Measures their willingness to take a new task or a solved problem independently. The fourth one is communication or a listening skill, assesses how well they communicate and listen to their feedbacks. Last one is dependability, examines the reliability and truthworthiness. Check marks are placed under the different rates on the placeholders, demonstrate where the employee might fall on the scale. This form allows to afford a detailed comments on each category, making it ideal for evaluation of a newly hired employee. Now we will walk through the employee performance assessment tablet, which consists of the punctuality and the attendance. This section measures whether the employee consistently arrived on the time and communicated properly in the case of the absence or the illness. Next one is the personal appearance. Personal appearance in this, employee maintained neat and tidy appearance or wore appropriate clothes or uniform for the workplace. Next one is the sense of the responsibility. In this section allows us how well the employee listen to the instruction and follow them without needing reminders. Fourth one is the interest in the position and the training. It is also an important area. It is a part of assessment that reflects the employee's enthusiasm for their role and their engagement in the training opportunity. Next, fifth one is adherence to the policy. This section where the employee consistently follow the company policies and demonstrate a responsible attitude. Sixth one is the quality of the work. It is crucial for assessing how effectively the employee complete their tasks and meet the quality standards. Seventh one is additional comments. This is the final section where specific observation or the feedbacks can be added. This allows the manager to provide further context about the employee's strength, area of the weakness or area of the improvement. This performance assessment template covers various aspects essentially to the employee's success, from punctuality to the policy adherence or the work quality. By using this template, manager can give balanced and constructive feedbacks that provide employee development and the workplace effectiveness. Now let's see what is an employee assessment review chart. Finally, the employee assessment review chart. It consists of a structure of the matrix format that include employee information section that was similar to the employee form. Next thing in this chart is characteristics rating. This section rates the performance characteristics which are with icons representing for the four level: unsatisfactory, satisfactory, good and excellent. It covers a specific area such as work to full potential, quality of work, work consistency, communication, independent work, take initiatives and group work. The use of the visual icons for each rating level provides at a glance review of the performance, making it ideal for a quality identification area where an employee can excel or need the improvement. This is particularly useful in the large organization where a quick performance comparison across the multiple employees may be required.
I'm going to talk about the three criteria for performance assessment, and the first is clinical proficiency. This refers to nurses' ability to execute accurate nursing procedure, strictly adhering to the established protocols and ensure proper and safe use of medical equipment. Proficiency here ensure patient safety and high quality care delivery. And the second is the communication skills. Effective communications is vital in healthcare. It involves not only interacting clearly with patient, families and team members, but also maintaining timely and accurate documentation. Clear communication reduces errors and enhances teamwork. Third is time management. Nurses often manage multiple responsibilities simultaneously, prioritizing tasks, meetings and deadlines, and remaining adaptable in high pressure environments are essential skills that ensure efficiency and continuity of care. Fourth is critical thinking. Healthcare is dynamic and unpredictable. A nurse's ability to analyze situation, make informed decisions and resolve issue proactively in crucial or delivery time and effective patient care. The fifth is adaptability. In the ever-changing healthcare environment, nurses must adapt quickly to new systems, adverse patient needs and fluctuating workloads. Flexibility is key to maintaining performance under varying conditions. Sixth is teamwork. Nursing is rarely a solo endeavor. It requires active collaboration with colleagues, fostering a positive and supporting team environment to deliver the best patient outcomes. The seventh is patient-centered care. At the heart of nursing is the patient. Delivering care that is empathetic, culturally sensitive, and aligned with patient needs while prioritizing safety and confidentiality ensures trust and satisfaction. In conclusion, together, these criteria establish a framework for maintaining high standard in nursing practice. By evaluating and developing these areas, healthcare organization can ensure quality care, enhance teamwork, and promote continuous professional growth. Thank you.